How are you? Welcome to another question and answer session. An 83 years old lady present with multiple patches of pigmented irregular superficial lesion over the torso, that means in the body. They don't bleed but have become increasingly itchy. What is the best course of the action? So an 83 years old lady present with multiple patches of pigmented irregular, but this is superficial lesion. This is very important. As this is superficial lesion, so their investigation and their surgical workup will be different than that of the deeper tissue. So what will be the best course of the action? So what we have to do first? We have to go for investigation or we have to go for surgery. So what we should go for investigation first. Here are the options, and the options are shape biopsy, excisional biopsy, true cut biopsy, incisional biopsy, and wide local excision. So we have to find out one of the biopsy which may or which is applicable in this condition. So first of all, here we can see this type of the lesion. That means it located just outside the skin. It is just over the skin. So what type of biopsy we can take? So first of all, let's see these types of the biopsy. These are the excisional biopsy, incisional biopsy, punch biopsy, frozen section biopsy, exfoliative cytology, FNAC, and brush biopsy. So first of all, let's see the excisional biopsy. What is the excisional biopsy? The excisional biopsy means suppose this is a tumor. When the whole of the tumor or whole of the mass is removed surgically, this is known as the excisional biopsy. Second one is the incisional biopsy. In incisional biopsy, what usually done in the from the whole of the mass, usually a portion is taken, and there is the another technique. Here we can see the it is using the blade, and using the blade it is taking the biopsy, and it is known as the shape biopsy. And as it is the outer part, that means which is the most superficial lesion, so in this condition the shape biopsy is enough. Excisional biopsy, true cut, incisional, and wide surgical excision biopsy, they are not targeted here, because the excisional biopsy and incisional biopsy, they are taken in the larger lesions, and true cut biopsy, it usually done in the breast, and wide surgical excision, it also done in case of larger type of the lesion. But in case of the superficial and very small lesion, shape biopsy is enough.